This week's video is about cognitive behavioral therapy, also called CBT, but note that I'm going to use this term interchangeably with cognitive therapy or CT. My objective in this video is to provide an introduction to important concepts of the CBT model while also applying these concepts to understanding the model from a practical standpoint. If I could think of one word to describe this model, it would be restructure, and we'll talk about this over the course of the video. But to illustrate this now, if you look at the message here, you'll notice that you need to utilize a different way of thinking in order to translate the message. You don't need to learn a new language, but you need to make a cognitive shift and even restructure your thinking to understand it. Keep this in mind as we learn more about CBT. Make sure to take notes throughout the video to enhance your learning of the material. And please visit Resources and click on Doc Sharing in Sakai to download the PowerPoint and the accompanying materials for this video. Now, as we discussed in the first class, this is a global perspective of the psychotherapy models we'll be covering in the theories class. Our focus today is on cognitive behavioral therapy, which can be defined as a general classification for psychotherapy models that focus on dysfunctional emotions, maladaptive behaviors, and cognitive processes. Treatment procedures are action-based, goal-oriented, and explicitly systematic. So as we study this model, be thinking about how CBT concepts fit in with your own strategies for conducting therapy. Now, to help you understand the topics I'll cover in this video, I want to introduce a mind map, which provides an overview of the theoretical model we study today and throughout this semester. I will divide each lesson into 6 sections: central constructs, case conceptualization, goals and interventions, cultural implications, process of therapy, and spiritual perspectives of the model. Now, the mind map should give you a quick overview before delving more deeply into each section. Now, I want to present a case review to help you understand the concepts we'll be discussing. Note that this section is in green, and whenever you see green text in the video, it will refer specifically to this case. Please pause this video to read about Maria. Now, there are 3 central or foundational constructs to CBT. Let's take some time to analyze these. Now, the first central construct is automatic thoughts, which are distorted and contrary to objective evidence that occurs in one's environment. These thoughts are swift, evaluative statements that are often dysfunctional. Note that during this week you will be keeping an automatic thought record to better understand how automatic thoughts work in your life. Now, take a moment to ponder what might be some of Maria's automatic thoughts. Regarding her husband, one might be, "He doesn't understand me." What others can you think of? Now, the second central construct involves beliefs. Core beliefs are deep-seated and usually focus on feelings of helplessness, unlovability, and worthlessness. Intermediate beliefs are assumptions or conditional beliefs that lie between our core beliefs and automatic thoughts. Let's look more closely at core beliefs, specifically at the first 2, helplessness and unlovability. Here is Judith Beck's core beliefs model, which includes self-descriptions for the categories helpless and the unlovable. Pause the video and consider which resonates most with you. Now consider the core beliefs that may describe Maria. Notice that she may have both helpless core beliefs and unlovable core beliefs. So it's important to note that beliefs about yourself, about others, and about life in general can have a strong impact on your identity and on your outlook on life. Now I want to provide a chart to illustrate how our thoughts and beliefs work on a rudimentary level. I call this a situation chart, and I'll expand it so you can see each segment more clearly. Typically, a situation occurs, a core belief is activated, which in turn activates an intermediate belief or series of assumptions, and we experience automatic thoughts as a result. Then we react accordingly on emotional, behavioral, and physiological levels, the final aspect of which could include sweating or blushing. Now let's consider the third central construct, schemas, which are cognitive structures that help us organize information. Look at this more closely. We can think of schemas as internal representations of the world based on our organization of concepts and actions. And note that they can be revised by new information about our environment. Schemas reflect our underlying cognitive organization and help us create meaning. They also directly impact our core beliefs. Let's take two examples. What might be some of the schemas about your workplace or places where you've worked in the past? What schemas do you have about your family or families in general? Now, what might be some of Maria's schemas about her workplace? About her family? Let's take this one step further and discuss faulty schemas, which are also called cognitive distortions or misconceptions about our environment. Here is a cognitive distortions, faulty schemas handout which you'll receive in class and can also be downloaded in the doc sharing folder under resources in Sakai. Which are most applicable to your thinking style? Now here's a second page. Yes, there are more. Would any of these apply to you? Please realize that you may experience more than one. Now, which cognitive distortions are applicable to Maria's thinking style? One idea is overgeneralization, which she feels both at home and at work. Which others may apply to Maria? So to recap this section, there are three central constructs that are essential to CBT: automatic thoughts, beliefs, and schemas. Think about how these three constructs are foundational to this model and how they impact our thoughts, feelings, and behaviors. Now, because case conceptualizations are so important in understanding our clients, let's consider a case conceptualization of Maria using a simple basic ID format, which is often used with the CBT model. Note that the beginning of each letter, such as B for behavior and A for affect, makes up the acronym BASIC ID. Please pause the video to review this more carefully and note how cognition, including core beliefs and faulty schemas, relates directly to the central constructs we just discussed. Now let's move to goals and interventions, which are crucial to cognitive behavioral therapy. Here is a basic outline of goals inherent in this model. As CBT therapists, we desire to help clients discover and label irrational or maladaptive thoughts. We instruct clients in more adaptive or more rational thinking, and teach internal verbal coping strategies such as working on less destructive automatic thoughts. And in doing so, we are restructuring our clients' thinking. We also help clients incorporate new, preferred behaviors, and we support them as they apply new and developing skills in their lives. It's important that we think in terms of the client's goals and not the therapist's. So here's what these goals might look like from a client's standpoint. With this in mind, what goals should Maria set for herself? One idea would be to help her challenge negative automatic thoughts about her husband. What others can you think of? Now that we've reviewed goals, let's look at some of the prominent interventions of CBT. I want to note that it's important to consider which interventions would be used to reach a particular client goal and the reasoning behind choosing the goal. So please keep this in mind and utilize supervision when considering the right interventions for your clients. Now, for our first intervention, we'll discuss cognitive restructuring, which involves changing client cognitive structures, modifying or reducing the negative impact of schemas, core beliefs, automatic thoughts, and depressogenic or depression-based assumptions. In Maria's case, cognitive restructuring may involve helping her to challenge maladaptive beliefs, using questions such as, what is the evidence that others do not respect her? Now, relaxation and breathing techniques are also a powerful intervention which CBT therapists use, as do therapists who practice other psychotherapy models as well. I want you to read this very descriptive intervention used by Donald Meichenbaum with a client suffering from panic disorder, and listen to his calm and caring tone as he talks to the client.
And as you let it out this time, I want you to imagine you're blowing on a spoon of hot soup so that you're not spilling it. Feel the warmth and calmness.
Think about how this could be beneficial to Maria. As she focuses on her breathing, she can begin to restructure her thought processes, train herself to be aware of maladaptive thinking, and counter it with deep breathing techniques. Also note that both cognitive restructuring and relaxation techniques are demonstrated in the Meichenbaum video that you're assigned to watch. So please take note of effective ways to use these techniques in therapy. Another intervention is ABC theory, in which a situation is characterized as an A, activating event, B, belief, and C, consequence. Here's an example involving an invitation to lunch, when A, the invitation is rejected, which is the activating event, B, the person believes they are being rejected, and C, as a consequence, the person feels worthless. The therapist would use the ABC intervention to help the client analyze and challenge these beliefs. Next, a downward arrow technique is an intervention that would be used to identify a client's core beliefs. You'd start with surface questions, but gradually get deeper as you seek to understand the meaning behind the client's thoughts. Here's an example of Calvin's downward arrow technique, but you probably won't want to go this route in your clinical practice. Other interventions include automatic thought recording, also referred to as dysfunctional thought records, questioning or simply asking the client to think, what was going on through my mind right now? Here are some more questions that can be asked to challenge negative automatic thoughts, and pause the video as needed to reflect on these questions. We can also use Socratic or more open-ended dialogue or direct instruction called spoon feeding. Now remember the Meichenbaum text from the video? It's an example of spoon feeding, and yes, it includes a spoon of hot soup. Additional interventions that may be more familiar to you are activity scheduling and assertiveness training. And speaking of Meichenbaum, I want you to view the Meichenbaum video to give you a better sense of how some of these interventions can be effectively applied in therapy. Now, in recapping this section, I just want to add that there are many more interventions in CBT, and I hope you will do some research to learn more about them. There are many cultural implications to consider when using CBT, including the fact that it is a Western-based model and may conflict with the values and norms of other cultures. We need to consider issues of individualism versus collectivism, how Asian and other cultures may view CBT, the collaborative nature which may work well with female clients, but also how the focus on the individual client may neglect environmental factors such as family and cultural traditions, and may bring about concerns inherent in lumping all cultures together. It's important to consider a spiritual perspective, and here I want to discuss how parables play an important role in explaining complex biblical concepts. How might restructuring be evident in the following parable from the Bible? Please pause the video to read the parable of the Good Samaritan. Consider what Jesus said to the law expert and how this may have helped him restructure his thinking. Also think about the powerful statement, "Go and do likewise," and its potential impact on challenging the law expert's assumptions about what it means to be a good neighbor. Note that you'll be keeping an automatic thought record for 3 days. When you've finished, go to the Sakai assignments section and write and submit a 1-page reflection paper focusing on what you've learned from the process. Note also that the process of therapy is integral to CBT, but instead of discussing it here, we'll learn more about this during our class session. Therefore, the upcoming quiz on CBT will cover 4 specific sections of the video: central constructs, case conceptualization, goals and interventions, and cultural implications. I hope this video and the accompanying PowerPoint and resource files will help you develop a basic understanding of the material presented. Good luck and have a great week.